Are you still confused about Botox and fillers? Gone are the days of fillers. You must have seen people are actually dissolving their fillers. So now the newer concept which is coming in is somewhat bioremodulation or delaying your aging. So for this, we have multiple treatment options and I'm going to decode it for you one by one. The concept right now is building your collagen, elastin, and the framework called as the building blocks of your skin. These are done with help of treatments like Profhilo, skin boosters, PDRN, and exosomes. They go inside your skin, the mid-dermis, where your actual framework of elastin and collagen are lying. These molecules go there, they strengthen your elastin and collagen, making your skin more firmer and more tighter. That is what the concept is nowadays. So as we all know that the building is made on a foundation. So your collagen, elastin, imagine they are like your foundation. They are your pillars which are holding your skin taut and firm. So when your foundation is perfect, you can have a longer lasting results. You can see that your youthfulness can be lasted for a longer time. Explaining you about the building blocks, this is my entire part or my entire armamentarium which I have to delay signs of anti-aging. Let us start with the first one, which is exosomes. Then comes the Profhilo treatment. This is the skin boosters and this is your PDRN. So I customize this treatment according to individual patient needs, whether you have pigmentation, whether you want to deal with anti-aging, whether you want to delay your signs of aging, whether you want to delay your fine lines and wrinkles. So wait till the end of the video where I'll give you the finer details or the answer to individual solutions to each problem. For example, which treatment do I prefer Profhilo? Which one do I prefer PDRN? Which one do I prefer exosomes for? Rather than filling them, we are now moving towards delaying your signs of aging by making your collagen and elastin firmer. So let us start with the first treatment option, which is called as Profhilo. So this Profhilo is basically injectable hyaluronic acid. It is 64 milligrams of hyaluronic pure HA. So imagine I am introducing 64 milligrams of hyaluronic acid in your dermis. What will this do? This will give like an amazing food for your collagen and elastin. It will make them stronger and thicker. So this is how they act. Now it's a very simple treatment. I just have to inject you at 5 points, which is at your mid cheeks, at your lateral angle of the cheeks, your tragus, the mandible, and the hollowness around the mouth. So these are only 5 points. So the best part, this is only a 10 minutes treatment and you're good to go. The treatment is basically 2 sessions are done in a year, one at 0 weeks and the second is after 4 weeks. The best part, the downtime is minimal. The results of the Profhilo last for approximately 1 year and then you have to do repeat sessions. The best part, there is no side effects because it's only 5 points. Only there will be temporary mild bruising if there is some at 1 or 2 places. So this is Profhilo. It comes in a syringe with 2 ml of the injectable hyaluronic acid. This is given at the 5 point at one go in 10 minutes. So the second treatment to delay your aging is skin boosters. So here are the skin boosters. Basically, they are only 12 milligrams of HA or hyaluronic acid. So they are not as powerful as Profhilo, but they are short lasting, but they give immediate results. So basically they give very good hydration on your skin. You get that instant brightness on your face. So how does it act? Basically, this is injected in your mid-dermis or just below your skin as small tiny blebs. The skin boosters are much shorter acting. This is a treatment again of 2 sessions, 0 weeks and 4 weeks, but the effect is lesser. It lasts only for 4 to 6 months. So this is good for people who are looking for immediate brightness, if they have some functions, if it's a very good treatment for pre-brides or for people who are looking for immediate glow for their wedding. The downtime again, as I said, is minimal. Basically, there are multiple pricks, so you have a downtime for approximately 24 hours where there will be small, minor swelling and redness. The longevity, as I said, is last 4 to 6 months. So this is how an injection of skin booster looks like. The needle size is very small. It's 1 ml of a syringe, and we use 2 ml at a time, one for one side of the face and one for the other side of the face. My third go-to treatment for delaying signs of anti-aging is PDRN, or polydioxyribonucleotide, or it is also called as the salmon sperm treatment, which is a very common buzzword right now. So basically, what is a salmon sperm like? So in this treatment, what has been found out that the salmon sperm matches very close to the human DNA. So when we give this treatment to the patient, it mimics like we are giving a new DNA to your skin. So what does the DNA will do? It becomes a building block for your collagen and elastin. So when we inject that, they stimulate fibroblast. Because of that, you start getting more collagen and more elastin. So the concept is again building the framework of your skin. So this is how like a PDRN looks like. So what we do is we inject PDRN in your skin at the 5 points, which is again the mid cheek, the lateral cheek, the tragus point, the mandible, and the lower corner of the mouth. These are the 5 lifting points which we inject the PDRN. Along with this, we do micro needling on your entire face and then massage the PDRN on top of it so it reaches the base of your skin. 3 sessions are done at a monthly interval, and the longevity of this is approximately 1 year. Now, what are the downtime of this? Basically, again, since there is micro needling and injection, mild swelling and redness, which lasts for approximately 24 hours, you start noticing or seeing results by approximately even after the first session. What are the main improvement you will see? First, you will say that, doc, my skin is looking much hydrated. Second, you will see your pigmentation looking lesser. You see the minimizing in the open pores also, which is going to happen. Your acne scars are going to settle down a little bit, and you will see that your skin is looking more lifted. So it has multiple benefits and with a lesser downtime. So this is the topmost brand called as 𝐃𝐞𝐞𝐦, which is made from Italy. So the fourth treatment for delaying signs of anti-aging is exosomes. Now this is the latest and the biggest word which you might have heard recently, exosomes. What are exosomes? This one is specially derived from human umbilical cord stem cells. So you have 2 types of exosomes. One is from plant derived and is from human derived. So this is human derived stem cells. It is removed from the umbilical cord of a fetus. Now what it does, when we introduce this to your skin, it will go in your DNA. It will tell your DNA to produce good quality fibroblast, which leads to good collagen production and elastin production. So this is how the exosomes work, by telling your DNA, your fibroblast, start producing better quality, thicker elastin and collagen. Now, how do I do this treatment? Again, this treatment is a 3-session treatment. It's mostly injected and derma rolled into your skin. So here we introduce it on the entire skin. We give small pricks in the mid dermis, followed by micro needling of your skin and layering this exosomes on top of your skin so it gets absorbed and it reaches the root of your skin. This treatment is 3 sessions. It lasts for approximately a year. If we consider the downtime as the previous treatments also, this is a downtime of 24 hours where you see some redness and swelling which may persist for 24 hours. Now, what sort of an improvement you are looking at with this? So this is more for collagen stimulation. It works for anti-aging, that means it reduces fine lines and wrinkles. It also works on acne scars, but it has a lesser impact on pigmentation. So this is the 4 treatments which are put together to help you in delaying signs of anti-aging. As the concept was of delaying signs of aging, when do you, or when as a person, you should start doing these treatments or start thinking about this treatment? As we are seeing, life is moving forward. Baldness is getting earlier, diabetes is getting earlier. Similarly, signs of aging are also coming earlier. Now, early 20s or your mid 20s is the newer treatment plan where you should start considering doing this treatments of delaying your signs of anti-aging. So an ideal person would be starting from 25, anywhere from 25 to 40 is your person who are looking for anti-aging treatments. When you cross 45, 50 and you have not done anything, you have lost all the collagen and elastin. At that time, you will have to go for fillers and those kind of treatment. So if you are the people who don't want to dissolve your fillers or don't want to go for filler, then you have to start these treatments earlier when you are at 25 and 30. So now what I'm going to do is I'm going to decode an individual person with certain problems and I'm going to tell which is the right treatment for them. Now, for example, a male or a female in their 30s who has a corporate life, very busy lifestyle, cannot come in the clinic multiple times, only has half an hour to do a treatment and has no budget constraints, then my first plan of action would be the Profhilo treatment for them. It's a quick 5-10 minutes procedures with minimal downtime of 6 hours, so it will not affect their busy lifestyle. A bride or a bridegroom, a person with dull, dehydrated skin, someone having cracked lips, someone wanting an immediate glow, has a little bit of time of 2 hours, I would go for the skin boosters. Results are immediate, but they are shorter lasting. Third case scenario, a person with a lot of open pores, dull hydrated skin, looking for anti-aging treatments, has some amount of pigmentation and in their early 30s, my first plan of treatment would be the PDRN because it works in all the indications which I said. Now fourth case scenario, male or a female in their mid-30s having a lot of acne scars, open pores, wanting to lift their skin and delaying the signs of aging, I would go for the Exosomes therapy, which is a treatment of 3 sessions and the results are longer lasting. So this is my entire armamentarium and for which indications I use what. So if you also want to understand or want to start your anti-aging or delaying your signs of aging, then you know who to contact. If you have liked this video, do share and subscribe with your friends and also let me know in your comment section which video do you want me to do next.